Hi, everyone. My name is Nicollette Gooding. I am a Master's of Social Work student at the University of Toronto, currently completing my practicum with For a Safer Space. Today, I will be sharing information about violence against women and how impacts of violence can contribute to certain health concerns. Impacts on mental health. Experiences of violence and forms of abuse can have significant impacts on women's mental health. Systemic reviews examining the link between violence against women and depression have found significant higher rates for women who have experienced violence in their lives compared to general populations of women. In Canada, the lifetime prevalence for depression of women who have experienced forms of violence is estimated to be 12.2%. Among mental health inpatient populations, one study estimated that 83% of women had been exposed to severe physical or sexual violence as a child or adult. Although women who have varying levels of mental health are more likely to experience violence, for many women, mental health concerns develop in response to the violence and feelings that arise from those experiences. This is important to be mindful of and not stigmatizing mental health or seeing mental health conditions as a cause of violence. Women with existing mental health conditions. Abusers may use a woman's level of mental health against her, for example, by keeping medications from her, over-medicate her, take advantage of changes in her symptoms or feelings, claim that she is an unfit mother, parent, and minimize her credibility in the eyes of the law and her personal relationships. Although women who have varying levels of mental health conditions are more likely to experience violence, for many women, mental health concerns develop in response to the violence and feelings that arise from those experiences. Researchers argue that many women experience social conditions of inequality, in particular experiences of violence, precipitated that their entry into the medical health system would be facing more barriers and difficulties. As a result, many researchers and service providers believe that it would be rare for women to experience violence without having some kind of mental health consequence. Violence against women are the leading causes of depression, PTSD, and anxiety. In fact, the World Health Organization has declared violence against women to be the leading cause of depression for women. Therefore, researchers and women themselves believe that many mental health concerns are natural responses to the violence women experience and should be responded to as such with adequate support systems and services in response to this social injustice. Understanding the complexity of a woman's positionality is vital in providing non-harmful support. And despite the evidence of these kind of frameworks, the connections between violence and mental health are often lost. Research shows a trend in which health and mental health professionals have been increasingly labeling women who have experienced violence with a mood disorder diagnosis, such as depression and borderline personality disorder, with little or no consideration for the social context that may be contributing to her concerns. These mental health labels can be stigmatizing and further create barriers to these clients accessing service and getting the support that they need. For example, women with bipolar disorder are sometimes seen as difficult to work with and are referred on or even refused access by service providers. Whatever diagnosis a woman is given, anti-violence, trauma-informed advocates believe that it is up to the woman to decide whether or not a mental health label makes sense or applies to her personal experiences. Women who experience violence are prescribed more medications for anxiety and depression than any other mental health condition. These medications are often prescribed without consideration of any underlying social problems that may be, again, contributing to the woman's experiences of violence. For example, Anti-anxiety medications may help women feel less anxious, but for some women, these medications actually are in the way of them feeling safe. In addition, these medications can be very difficult to stop using, yet many anti-violence and specifically transnational housing programs require women to take medication, undergo a thorough assessment, and have to contact mental health providers if the woman does disclose any mental health concerns. Again, this can actually further instill barriers in the women getting the help that they need. It is very important to remain mindful of providing trauma-informed service, remaining mindful of women's intersectional identities, as well as the existing social conditions contributing to their hardships, is vital in providing trauma-informed service that supports clients' sense of worth and validates their story and truth. Thank you for taking the time to watch this video, and take care.